Thank you for joining us for today's educational webinar about surgical weight loss procedures.
Taking care of your health is probably the most important thing you can do for yourself and for the people who love you.
Grand Traverse Surgery and Munson Medical Center have offered surgical weight loss procedures since 2003. In that time, we've helped over 3,000 people regain their health through a permanent weight loss solution.
Many people have gotten a second chance to live their lives to their fullest following bariatric surgery. It's been our privilege to share the joy and excitement that they feel when they can once again do the things they enjoy.
Our team of bariatric surgeons will only perform surgery if it is the best choice for the patient's health. We witnessed some remarkable results. Many of our patients have had resolution of heart disease, diabetes, sleep apnea, and acid reflux.
Electing to have any surgical procedure is a serious decision. Weight loss surgery will dramatically change your life forever.
You must make this decision carefully. Bariatric surgery isn't a quick fix or an easy way out. To be successful, you will have to make lifelong changes in the way you live.
Before we get started, I want to mention that you must watch the entire webinar and attend an educational seminar in person to move on to the next step. At the end of this presentation, you can fill out a short questionnaire. If you indicate you are interested in meeting with us, we will follow up with you and answer any questions that you might have.
Thank you again for participating in today's webinar. Let's get started.
5 highly experienced surgeons practice at Grand Traverse Surgery in Traverse City. The physicians at Grand Traverse Surgery are general surgeons who specialize in bariatric procedures. About half of the surgeries they perform involve weight loss surgery. They assist each other with all bariatric procedures. Grand Traverse Surgery is easy to find. The office is located at the corner of Front and Division Streets, a main intersection in Traverse City. The office is run by knowledgeable, friendly staff members who help patients with everything from making appointments to answering billing questions. If you opt for weight loss surgery, you will come to know each of them well. All weight loss procedures are performed in Munson Medical Center's state-of-the-art surgical suites. If an overnight stay is needed, patients stay at Munson Medical Center. The hospital has been nationally recognized many times for outstanding quality and patient safety. Obesity is a chronic disease in which a person has too much body fat. Carrying excess body fat often leads to serious multiple health problems. 2/3 of American adults are overweight or obese. In fact, obesity is now the second highest cause of preventable death in the United States. In June 2013, the American Medical Association officially recognized obesity as a disease. A number of factors contribute to obesity. Being obese is often the result of a combination of influences, such as the genes you inherited from your parents, how well your body turns food into energy, your eating and exercise habits, your surroundings, and psychological factors such as boredom, sadness, and anger. A person's risk of dying increases dramatically as their body mass index, known as BMI, increases. About 8 million people in America are morbidly obese, meaning they have a BMI of 40 or more. They are at high risk of dying from complications associated with obesity. More than 30 medical problems are directly related to obesity. The ones that cause the greatest concern are Type 2 diabetes. About 30% of people who are overweight or obese have diabetes. Heart disease, high blood pressure, sleep apnea. There is a higher risk of all cancers in people who have a BMI above 35. There is a higher risk of vascular disease and stroke, high cholesterol, depression, chronic low back pain and joint problems. Chronic acid reflux is also common. Urinary incontinence, infertility, and the list goes on. Non-surgical methods of weight loss include medically supervised diets, exercise plans, medical weight loss programs, prescription medications, and behavioral therapy such as hypnosis and counseling. All of these can help a person lose weight. Unfortunately, less than 10% of patients who are severely or morbidly obese achieve success with these methods. Since 1991, the National Institute of Health has endorsed surgery as the only way for people who are severely or morbidly obese to achieve long-term weight loss. Bariatric surgery is considered successful if the patient loses more than 50% of their excess body weight within 18 months following surgery. Patients who have had surgery at Munson Medical Center typically achieve that goal by 9 to 12 months and are often achieving 70 to 75% excess weight loss by 12 to 18 months. Munson's bariatric surgery program accepts people from ages 18 to 70. Using National Institute of Health criteria for weight loss surgery, patients must have a BMI more than 40 or a BMI above 35 with one or more obesity-related health conditions, have documented failure of previous weight loss attempts. Some insurance companies may also require completion of a 6-month medically supervised weight loss program. Patients must have a commitment to lifelong behavior change and a willingness to adapt to change, including exercise, changing the types of food consumed, the number of meals eaten, and thoroughly chewing food. Patients need good family and/or spousal support. They must comply with the post-operative program, including periodic physician follow-up visits for life. And patients must pass a preoperative evaluation. Surgery is an option to consider when other weight loss options have failed. 3 types of procedures are offered at Munson Medical Center. Malabsorptive procedures shorten the digestive tract and limit the body's ability to absorb nutrients. The Duodenal Switch, also known as the biliopancreatic diversion, is a malabsorptive procedure. Restrictive procedures reduce how much the stomach can hold at one time. Vertical sleeve gastrectomy surgery is a purely restrictive procedure. Combined restrictive and malabsorptive procedures shorten the digestive tract and reduce how much the stomach can hold. Roux-en-Y gastric bypass is a combined procedure. Vertical sleeve gastrectomy surgery only involves the stomach. It is a purely restrictive procedure that consists of stapling and reshaping the stomach into a long, narrow tube and removing more than 80% of the stomach. The narrower stomach sleeve restricts food intake and results in a quicker sense of fullness. No new connections are made between the stomach and the small intestine. There is no rerouting of the intestine, no malabsorption, no foreign body device, and no dumping syndrome. The rate of weight loss is similar to what is achieved through a gastric bypass, but total weight loss achieved is often slightly less than gastric bypass. Surgery time and recovery are similar to gastric bypass. Sleeve gastrectomy can be used as a first-stage operation to convert to a bypass or duodenal switch. Roux-en-Y gastric bypass most commonly is performed laparoscopically through 5 to 6 small incisions. The open procedure with a larger incision is reserved for complicated cases. During the procedure, a portion of the stomach is made into a small pouch, about the size of a thumb, to restrict food intake. A section of the small intestine is attached to the pouch. Food bypasses the stomach, duodenum, and the first portion of the jejunum. A small outlet between the stomach pouch and the small intestine slows the rate at which food leaves the pouch, causing a feeling of fullness. Patients typically are able to consume about 1/2 to 1 cup of food at a time. Gastric bypass usually requires a 2-day hospital stay and a 2 to 3 week recovery. Long-term follow-up is essential for good success. Patients need lifelong supplements and multivitamins, and routine labs are required lifelong to watch for any deficiencies that could develop. Advantages include more rapid weight loss and better long-term weight loss. Another major advantage is the correction of medical conditions, such as diabetes, high blood pressure, and sleep apnea. This procedure can cure type 2 diabetes rather quickly. Most patients are off their medications for diabetes within 2 to 4 weeks. Eating too much sugar or too much food in general can cause dumping syndrome. This is considered a positive side effect built into the surgery because patients feel nausea, bloating, cramps, perspiration, fast heart rate, faintness, and sometimes diarrhea, which teaches them to avoid high-caloric foods such as soda, candy, sweet fruit, milkshakes, and sweetened cereals. It helps to modify the behavior that led to obesity. A disadvantage is that gastric bypass can result in nutritional deficiency and malabsorption. Reoperation is sometimes necessary due to bleeding, hernias, ulcers, bursting of stitches or staples, leakage, blockage of the intestines or stomach, or other causes. Another disadvantage is it is non-adjustable and a permanent procedure. There is no easy way to reverse this procedure. The duodenal switch involves a sleeve gastrectomy as well as an intestinal bypass. A longer bypass is performed. It is more difficult to perform this surgery, and it has a higher risk, but it also has the best reported weight loss of all bariatric procedures. However, there is significantly more malabsorption and nutrient deficiencies compared to gastric bypass, so this represents only a very small percentage of all procedures performed. Complications that should be considered fall into 3 categories: those that take place during surgery, short-term, less than 30 days, and long-term. Intraoperative complications include unexpected things that happen during surgery, such as equipment malfunction, anesthesia complication, bleeding, heart or lung complications. Roux-en-Y complications include a death rate of 1 in 750. Main complications that can be fatal are pulmonary embolism or a gastric leak that leads to systemic infection. Fortunately, those are rare. There is a 0.2% chance of pulmonary embolism and a 1% chance of gastric leak. Other complications include risk of bleeding, infection, bowel obstruction, potential need for readmission and/or reoperation, and the risk of nausea and/or vomiting. Long-term complications can include stomal stenosis. This happens when the connection between the gastric pouch and the small bowel narrows and obstructs the outflow of food. A stomal ulcer can occur at the same junction, just below the gastric pouch. This can happen in patients who take aspirin, ibuprofen, or any kind of anti-inflammatory drug, such as Aleve. Patients who smoke after gastric bypass can have a high rate of developing ulcers. Patients must be non-smokers for 8 weeks prior to surgery and be committed to avoiding alcohol for at least 1 year after surgery. Some patients have a higher output of acid and are at higher risk of developing an ulcer in this location. Another complication is that the gastric pouch can stretch over time. The connection that empties the pouch can become larger and over time make it easier for patients to eat more food and have larger portions, which can result in weight regain. Long-term, a bowel obstruction can occur. Anytime an operation is performed, there is the potential for adhesions to form internally that can obstruct the intestine. Staple or suture lines may leak, resulting in infection involving the stomach or the skin. Patients may experience changes in bowel habits, including diarrhea, constipation, and gas. Gallstones can occur with rapid weight loss. Hernia formation was typically more of a problem with open procedures. The move to laparoscopic procedures has essentially eliminated hernias. Other complications include nutritional deficiencies. Therefore, taking vitamins and undergoing routine lab work for life is needed to assess the patient's micronutrient levels. Periodic vitamin injections may be needed. Sleeve gastrectomy complications are very similar to gastric bypass complications in the short term. Long term, there really aren't many complications. This procedure has the lowest long-term complication rate of all bariatric surgeries. Some patients fail to lose enough weight with these procedures. This is typically because of lifestyle choices, not a complication of the procedure itself. Some patients can lose too much weight. That's a rare event. Some patients will require reoperation or other procedures due to one of these complications. After seeing the list of complications, some people can be afraid of undergoing surgery. However, if you consider the long-term health risks of obesity, the complications that come from obesity far outweigh the risk of surgery. In the long term, there is increased risk of obesity-related health complications, such as diabetes, heart disease, cancer, stroke, sleep apnea, and even premature death. Surgery has its limitations. It is an effective tool, but it is just a tool. What patients do with that tool is what determines whether or not they achieve their goal. Patients who comply with the diet and exercise guidelines always have a much better outcome than patients who skip the steps. It's very important that patients have a good support system. That includes spouse and family, attendance at a monthly support group, and a good surgical support team to encourage and follow long-term success. Weight loss surgery is not a quick fix, a guarantee that you will lose weight, a cosmetic operation, and it's not magical. It requires effort and commitment from the patient. You have now completed the webinar. The next step is to fill out the Bariatric post-webinar questionnaire, which includes a short true-false quiz. If you are interested in learning more, please contact Grand Traverse Surgery at 231-346-4014. It also will be helpful for you to attend a support group meeting before your surgery to meet people who have had the surgery and can offer practical tips for success. Thank you for joining us for this educational weight loss webinar. We look forward to assisting you in your long-term weight loss goals.